One of the major misconceptions that people think that they should do with the toothbrush is actually brush with the flat edge. Now, everybody brushes with the flat edge, and one of the issues with that is when you try and brush with the flat edge, when you put the brush against the tooth, you see these gaps, these triangular gaps that fill in between all the teeth. The only way to even get your toothbrush to fill that gap is to push very hard with the toothbrush just to get it in there. And nobody brushes this hard. You shouldn't be brushing this hard. This can cause damage to your gums and teeth. So how can we brush gently and get an effective scrubbing? And this is how much pressure it actually takes for you to rub plaque off your teeth. Not this hard, this hard. That's really all that you need. So it's not in the pressure, it is in all the technique. So the first step to do is not to hold the toothbrush perpendicular to the teeth, where the flat edge meets the tooth perfectly. The best thing to do is actually to turn the toothbrush at a 45-degree angle at the gums. Push the bristles in and kind of jiggle it and kind of let it dig a little bit into the gums and move it back and forth just a little bit, and then you want to scoop whatever that is out inside the gums. So again, you're going to push 45-degree angle, dig a little bit, and scoop out. And what I would do is 1, 2, 3, 1, 2, 3, 1, 2, 3. Jump over to the other side. 1, 2, 3, 1, 2, 3, and you notice it's just a roll. 1, 2, 3. So it's very different from your typical circular scrubbing. Remember, there's gaps and spaces everywhere that you're missing when you do this circular motion. And not only that, but all the gaps and spaces right along the gums you miss with this flat surface. One of the other areas that most of our patients have trouble cleaning is actually behind the back teeth. Now, this is the smallest area in your mouth. Most people will use the flat edge of the toothbrush again and just kind of scrub it like this. And of course, you can imagine there is tons of areas back here that just does not get brushed. And so what is the best way to brush the back side of this teeth? Actually, just by using the very, very, very front edge or the very, very, very back edge. For the majority of the time, you could use, just like I said, the front edge. You would slide it down at a 45-degree angle, and it's more of a jabbing motion. You jab, you push down, and you do a little wiggle, and you scoop. And then I would do it for each tooth. 1, 2, 3, and want to brush for about 2 minutes. What's so special about 2 minutes? 1, it actually gives time for your fluoride toothpaste to actually even work. Fluoride is the primary component to reversing all the acid damage that gets put onto your teeth. And if you only allow the toothpaste to sit on your teeth for 30 seconds, it's only going to be active for 30 seconds. Another area that people tend to miss is the back side of their teeth. So they think that they should jump from here to here, but in truth, you should try to get the bristles to wrap around the back side of the teeth as well. This is the technique that I use when I'm brushing with a manual toothbrush, and I will have to say I now enjoy my 6 months cleanings.